Hello, everyone, and welcome to today's event. I am so excited about this panel. I am Jessica Mason Pieklo, the Senior Vice President and Executive Editor of Rewire News Group, and today we are talking about the biggest abortion rights fight in decades. We're going to be talking about abortion care in the South and what's at stake for the entire country now that the Supreme Court has decided it has something to say about the future of legal abortion. But first, a couple housekeeping items. We encourage questions. I have a feeling that folks are going to have a lot of questions and a lot of things to say. So if you have a question for our panelists, please use the Q&A tab at the bottom of your screen to submit it. I'll be monitoring that Q&A tab and doing my best to get to as many of your questions as possible. If I don't get to your question and you'd still like an answer after the event, please email it to events@rewirenewsgroup.com. That's events@rewirenewsgroup.com. And we'll do our best to get an answer for you, depending on what the question is. And you should use that same email, events@rewirenewsgroup.com, if you need any assistance during the event, because we've got a staffer on standby who's able to help with all of the tech stuff that I can't manage. So housekeeping stuff is out of the way. Let's get to our panelists who can really dive in. Shannon Brewer is joining us, and she is the director of Jackson Women's Health Organization, the only abortion clinic left in the state of Mississippi. JWO first opened in 1995 and has been the only licensed abortion clinic in the state for over a decade. Shannon's worked at the clinic for 20 years. We also have Laurie Bertram Roberts, who's the executive director of Yellowhammer Fund in Alabama. She's a leader in the reproductive justice movement with an extensive background in organizing in the intersections of reproductive rights, race, poverty, and disability. She's also the mother of 7 children and embodies the primary tenet of reproductive justice, which that every person has the right to have or not have a child as they choose. Laurie co-founded Mississippi Reproductive Justice Fund, the first patient-centered abortion fund to prioritize eliminating all forms of financial, governmental, and societal reproductive coercion. She is also a trained doula and midwife who works primarily with low-income women of color who need prenatal and postpartum care and birthing support.
Student midwife.
And Dr. Leah Torres is a generalist OBGYN and is the medical director of West Alabama Women's Center in Tuscaloosa, Alabama. She's trained in abortion care, clinical research, and general obstetrics and gynecology. I've been in this space for 10 years. I will never say that word correctly. I'm sorry. Dr. Torres is expanding patient care in Alabama, introducing full spectrum reproductive and sexual health services in the state. That is really very exciting. She's written extensively for places like Self Magazine, has authored over at Rewire News Group, and is currently working on a book about misogyny in abortion care. And last but not least, we have Erica Hensley, an independent health and data journalist based in Jackson, Mississippi, where she covers reproductive and health equity. Her COVID-19 work helped put national attention on Mississippi's response to the coronavirus pandemic, and she is the recipient of the Atlanta Press Club's Investigative Reporting Award. Welcome, and thank you all so much for joining us. So we are here to talk about abortion care in the South, and the Supreme Court has really forced that issue for us by taking up the Dobbs case. And there's always a danger, though, when we talk about abortion rights in the context of a court case, because that decenters the people who are most impacted and affected by these decisions, and those are the patients and the providers. So that's what I really hope that we can do in this discussion today, is use the case, use the Supreme Court stepping in now as the backdrop to talk about care in the South, what the Supreme Court taking up this case means, not just for Mississippi, but for the entire region and the rest of the country, because no matter what happens, by taking this case, the Supreme Court has signaled that abortion rights, at least as far as the justices are concerned, are up for debate in this country. And so we need to really set the record straight here. Shannon, I'd like to start with you and really set the table for our audience in terms of delivering care in Jackson. You know, this case is going to bring a big spotlight to the state and definitely your city. Already we're seeing media reports that highlight the fact that you have the only clinic left in the state, but this is hardly the first abortion rights fight that you guys have been in. In addition to dealing with the onslaught of legislative attacks from the state, you've also had local lawmakers repeal the protest buffer zone that kept some of the worst clinics protesters at bay a little bit. So I'd like to open the panel discussion up with you, if just kind of explaining for folks who aren't familiar with Mississippi, aren't familiar with Jackson, what it's like right now.
Well, right now, we're on pins and needles pertaining to the Supreme Court, but we've always been on pins and needles with the law, all the new laws that keep coming. It's a constant battle here, actually, because as soon as we get through one hurdle, there's something else that pops up, and this is like the major one that has come up, and the antis are getting worse. The police are doing nothing about it. The city is doing nothing about it. They tell us there's nothing they can do. It's at the point now we call the police, they don't even come.
Mm-hmm.
They've taken, like she said, we had the ordinance, all of everybody around in the neighborhood got together, got the ordinance. It was a noise ordinance and like a buffer zone ordinance. It was put in place. The city came and put signs up and everything. We weren't told. There was some secret meeting had. The next thing we know, the signs were being taken down. And we later found out that the antis decided to sue the city, as they do. And it's, for some reason, the city won't stand up. They get scared and back down. So they took the ordinance back down, and which leaves us basically on our own. It's like we're it's like an island up to itself. We have no help. We have no help around here. And it's getting worse. And on top of that, we have the Supreme Court thing that just came up. So now everybody's calling. We get constant calls every day because patients think we're closed. They think we're getting ready to close. So everybody's in a rush trying to get here and to make sure they're not going to be too far. And so this is what we're dealing with every single day. And since the Supreme Court thing came, it's gotten even worse. It's our regular everyday issues that are going on with this on top of it.
So there's so much to unpack here. How many patients does your clinic see in a year typically?
Normally we see about 2,500 patients. This past year, due to COVID, is what we think is due to COVID. It has increased for about 700 or 800. So it was a little over 3,000 patients this past year, because a lot of clinics were closed, a lot of clinics were limited. We had a rough time this past year because we had to put in place everything for COVID. So we were only seeing a certain amount of patients, which made my staff we worked basically from morning to night, and our doctors.
And I don't know that folks appreciate the impact that something like a buffer zone can have in terms of protecting patients and providers in doing your day-to-day job, and just in preparing for the panel and just existing in the space. I've seen a lot of coverage of what it's like outside of your clinic without the buffer zone in place. And I'm wondering if you could just speak to that a little bit for the audience, because even as someone who's existed in the space for over a decade, I was shocked to see the actions of some of the protesters.
Yes, without the buffer zone, the protesters are literally standing in the entrance where our patients come in the door, come into the parking lot. They block the parking lot so that the patients' cars can't come in. They are standing out there. They took our escorts have vests. They mimic their vests so that patients would think that they are escorts in order to stop. They throw pamphlets into the car if your window's down. They come onto the property because they know nothing is done about it. Several years ago, they were on the property, and I sprayed them with water hoses, and they put assault charges on me, and I had to go to court about that. But what do you do when the police won't help and the city won't help? What do you do at that point? So that's what we're dealing with. They stand on ladders. They have ladders that they're standing on, looking over the fence, peeping in and yelling at women. They have bull horns, and all of this is right directly against the fence where the patients are walking in.
It's criminal. I don't have another word for it. It's criminal.
You would think
Laurie,
it's criminal.
yeah, well, precisely. You would think it is. So Laurie, you are involved in direct aid, which especially during the coronavirus pandemic became even more critically important in the delivery of healthcare. And one of the things that folks may not know about what's going on in Jackson is, like the fight with the buffer zone, y'all have had a water crisis going on down there too. And so there was a lot of coverage of that in Texas and in the spring freezes there. But it really is a system that impacted much of the Deep South. And so as we talk about this case opening up a justice lens and the opportunity to really connect these dots for folks, this water crisis seems like a huge deal. Like, how does that impact care? How can we explain that this is part of the crisis in the South that the Supreme Court is really shining a light on for the rest of the country?
Yeah, it's deeply offensive to me for our state to be focused and spending money on this case and focusing on this case as if this is a public health crisis, when they will not spend any money in Jackson to fix our water system. They will not spend any money in the Delta to fix water systems in the Delta. They're not at all concerned about the lead levels that are happening under several zip codes in Jackson, Mississippi, how many kids are getting lead poisoning and higher lead levels than in Flint. They're not concerned about our maternal health crisis. They're not concerned about the infant mortality crisis. You know, like, and what is even more offensive is it's like some of the people who organize will be like, well, we need to spend more money on things that'll make it easier for people to parent. But what they leave out is not everybody wants to parent. You know, it's like Black women have the right to say no. We have the right to say, no, we don't want a fifth baby or any babies. Like, we have the right to not want to have kids. Like, I'm not sure why people don't understand that, but we have the right, regardless of what income you have the right to not want to gestate a human. And we don't owe anybody our damn babies. Like, quit telling us you can just give your child up for adoption. I don't owe no middle-class people my damn progeny. Stop telling people outside clinics that they can just give their children up for adoption as if it's some kind of easy process to just give up your children to someone else. And as if that is a solution for abortion. Abortion means I'm not pregnant no more. Adoption means I still have to gestate for another 8 months or 7 months or 6 months. That's not a solution. And the thing that kills me about the outside of the clinic is it's no better than, I was an escort in 2013. I had to stop because of my health. That's how I got into doing direct aid. And it's not so different than 2013. It's just worse.
Yeah.
And the people that are there now, they don't just harass the clinic. When the clinic ain't open, they out in the community, harassing folks, harassing churches, harassing businesses. Like, they're on a whole like anti-sin crusade in the community of Fondren. So I mean, like, they've even harassed the sweet potato queens, which are just a bunch of middle-class white women who get together and dress like provocative and raise money for children's charities, but they thought they were drag queens, so they protested there. I mean, like, it's just the caucasity of it all is just so many levels. And the fact that they keep wrangling in a few Black people to be their like spokespeople and to even front like they're actually pro-choice is even more deeply offensive.
So when you were working and delivering in direct aid with the water situation going on, did you see folks connecting these dots at all? I mean, you know, organizations like yours, are there really to help folks bridge the gap in getting the care that they need? Water seems like part of that care. You know, did this come up at all? I was really blown away by how just little I saw of this in the conversation at all. And so I'm curious, even within these spaces, you know, just how folks have been responding.
I mean, Black women get it. I don't have to explain to sisters like why we give out diapers and water and formula and school clothes and help with abortion care and pay for birth control and pay for IUD. Like, none of it, no Black woman has ever been like, oh, I don't understand why y'all do all that. every sister I've ever met and talked to. I mean, I'm talking about from older women who are like mothers of the church to young women get it, because they're like, oh, y'all not just focused on abortion. Thank you.
Mm-hmm.
I mean, they don't owe us gratitude. We do this for the community because we love the community.
Mm-hmm.
It's what I wish someone would have done for me when I needed abortion assistance. It's what I wish somebody would have did for me when I went to a CPC and they gave me like 5 diapers and told me I needed to take their stupid classes I didn't need. You know, excuse me, not stupid, silly classes I didn't need. You understand what I'm saying? Like when they were like, oh, we'll give you credit if you go to church and then you can earn a crib. Well, I need a crib today. I don't need a crib in 7 weeks. So like, that's the stuff that I'm like, we're trying to combat. And we don't ever have to explain that to folks who we organize with. Even folks who don't necessarily agree with abortion understand why you need this holistic like approach. What good is it for someone to quote unquote save a baby at the clinic if you're sending the pregnant person to go drink lead-laden water? That don't make no damn sense. And it don't make no damn sense to send them to unsafe housing, or they're homeless and sleeping on a bench, and then you call pro-lifers and they tell you to go to the housing department. Oh, thank you. Thank you for all y'all help. Round of applause. No, just, I'm done with it. Like, all they do is stand out there and use Jesus as an excuse to slut shame. I'm done. That's all I had to say.
So the court has given us an opportunity to really hone in on the structural barriers to care generally in the South, and focusing in on Mississippi. Dr. Torres, folks may wonder what a doctor in Alabama is doing on a panel discussion about a Supreme Court case in Mississippi. But I think the reality is that abortion knows no boundaries and borders, even as our politicians may want to put them up, and that no matter what happens in this case and with care in Mississippi, impact in the South and the rest of the country will absolutely be felt. And so I'm hoping you can talk about your practice as an OBGYN in Alabama, what's on the line for you in this case, and what folks need to know. I'm in Colorado. I think I have an idea of what it's like to try and get care in the South, and I'm pretty sure you're going to disabuse me of that idea.
Well, thanks. Yeah, I'm fairly new to the South myself, but having practiced in other conservative states and areas, basically, this case that's happening in Mississippi will, have the ripple effect across all of the South and much of the Midwest, if we're honest. So I want people to understand that as an OBGYN who provides abortion care, you understand that abortions don't happen in a vacuum. Reproductive health doesn't happen in a vacuum. You can't talk about 15-week abortion bans over here without talking about all of the other things that Laurie has mentioned before: clean water, access to health care and education. It doesn't happen in a vacuum. So all of these things are connected. And so while people want to really focus in on, a 15-week abortion ban, let's remember what this is and what it is not. So what it is not is medicine. And what it is not is in the interest of public health, specifically maternal health and neonatal health. We have an abysmal maternal mortality rate, period. Now, if you are Black or a person of color, that rate is 3 to 4 times worse than the already abysmal rate. So when you talk about banning abortion, or at least limiting any access to your option of being pregnant or not, and you have pregnant people dying, when you work to increase the number of pregnant people by not having the ability to be not pregnant if you don't want to be, that's essentially going to lead to more death. And so we have studies that show this, but it's really simple math. When you have a percentage of people who die in pregnancy, and then you increase the number of people who are pregnant, you have more people dying in pregnancy. It's not complicated. And if you have to look at it from a public health standpoint.
Mm-hmm.
This is not about abortion. This is about public health, public safety, and what our government is doing to erode public health and public safety. And we should not be complacent. And let's remember our history. This is reproductive coercion. We have a history in this country of reproductive coercion. Doctors committing reproductive coercion, doctors committing sterilizing people against their will without informed consent. That was happening legally, even into the 70s. So who did that happen to? Well, let me see, probably the lower socioeconomic and people of color in this country. It was systemic racism. This is another example of that. And we cannot narrow our focus to just, oh, this is abortion, so it's okay. It's not about abortion. It's about reproductive coercion, government sanction that is going to affect the health and lives of a specific group of people. And let's be honest about it. And then I'm done.
Well, I have a follow-up for you on that, because I really so appreciate you connecting those dots to all of reproductive coercion, because abortion bans in any form really are a form of abortion coercion. And I want to talk a little bit about your practice, because as I alluded to, folks don't necessarily just get care in the state that they live in. In fact, oftentimes these kinds of restrictions push them out into other places. And so I know that already we are seeing, if we think of abortion care as a balloon, that every time there is an attack in that balloon, it puts pressure up or down in that. What is it like in Alabama right now with this going on right in your neighboring state? And are there conversations about how you can brace for impact?
Well, certainly there are conversations, and we know that if Mississippi gets in trouble, we're going to be seeing more Mississippians than we already do. And the same when Alabama gets in trouble, Georgia sees more Alabamians. You know, like people are going to go where they need to go. Hopefully they'll be able to with the means that are necessary, because childcare is a thing. Time off work is a thing. Being able to afford transportation when there's a gas shortage, like there was recently here. You know, these are all very impactful, even on the day-to-day, without a looming Supreme Court case decision. So you have these effects all the time, and think about it. Why? You know, I don't think we're answering that question enough, because this is an aspect of healthcare that deals with a very specific group of people, which it has been deemed okay to oppress, right? So pregnant people are okay to oppress. That's what, you know, they just spit out the kids, it's fine. That's what they're there for, you know, and it's not okay. So we have a disproportionate oppression of people, because our society throughout the decades, centuries, have decided that this population of people it's okay to abuse and oppress them. It's fine, because that's for whatever reason acceptable. So we will feel it throughout the South, but the North is going to feel it. The world is going to feel it. I mean, just think about what happened with our recent administration. The world felt that. So there's a ripple effect that definitely happens. You cannot oppress an entire population and coerce reproductive health without it having an unforeseeably large impact.
Oof. Yes, that is so true. Erica, you are a journalist covering these issues in Jackson. And as someone who's been in this space for a while, you are going to have the misfortune perhaps, of having a lot of media attention on your community and a lot of reporters dabbling in abortion rights and impact in the South. And I am hoping you can speak to us in the media. What do we need to know, and how can we not screw this story up? Because it is too important of a story not to screw up.
Yeah, I mean, I think it's important for all journalists to first and foremost, as is our job, contextualize what's happening. I mean, this is not new or sudden, certainly. It's not random. I mean, it's been a slow and steady, intentional chipping away of these rights here for a while and across the South. And I think, like the other panelists were saying, it's our job to look at the intersection of maternal health and access to all reproductive care. I mean, reporters don't just go to the clinic and try and get the sensational shot of all of the anti-abortion protesters and, you know, back away from the clinic, look at all of the groups working towards solutions. There's more than we can name. If you're a reporter out there and you need help connecting to some groups, contact me and I will definitely help you. Because there are many women, mostly women of color, on the ground doing this work. And, you know, it's our job to show what it's really like here and look at who's doing the work on the ground. And then to kind of step back and look at the data and look at the context and see how it was able to get this far. An important stat to me is that 20% of women of reproductive age in Mississippi already don't have health insurance.
Wow.
So we're not starting from a place to give women preventive wraparound services before pregnancy, during pregnancy, or after pregnancy. And that's a really important piece that dovetails with the abortion care. That's related and it's both separate, because if the state cares about women and children the way they say they do, I think we would have different public health priorities. You know, one of the first abortion stories I wrote when I came to Mississippi was how much the state had spent fighting these laws that all had been deemed unconstitutional already. Just from 2012 to 2018, it was almost $1 million. And that is before the 15-week ban even went to appeal. So that right there speaks to the priority. And it's our job to look at that hypocrisy, interview the people who made those decisions, ask them why. One of the main authors of most of the abortion ban and other restriction bills here is Representative Joey Fillingane. And he'll tell you over and over and over again, it was his goal to get this to the Supreme Court. They weren't even veiling the intention there. And that's important to talk to them. If reporters that come down here, y'all need to spend some time in the legislature too and watch the authorship of these bills, because there's not a lot of debate.
Oof. Laurie, it sounds like you have something to add.
I just wanted to add that, like, I mean, it's Pride Month, so I wanted to add that, you know, a big contingency of a lot of the people working on the ground are queer folks. Like, it's a lot of queer women. There's a lot of queer women and femmes doing the work on the ground. Like, yes, there are a lot of, you know, cis het women in the movement, but a lot of the core work in the movement is being led and done by queer folks. And I think that gets overlooked. And also that, like, there's always this conversation that kind of goes on in quiet spaces around, well, I'm a lesbian and I don't need to do work around abortion because I'm not going to need an abortion. And I know Shannon can say it and I can say it. Oh boy, have we helped a lot of people who were lesbians have abortions. Like, there's no person, there's no category of person who can't wind up needing an abortion. Antis end up needing abortions, you know, like, don't even get me started. And to talk about Joey Fillingane is just one person in a little cadre of lawmakers who, one, yes, I mean, some of them have a real ideological feeling about this, but also this is how they make money. Like, let's just say it plain and talk about what this is. This is the wedge issue that makes them campaign cash. This is how they get people to the polls. This is model legislation that they usually get from AUL. They're not personally writing this crap. It's the same crap that goes all over state to state to state. You know, like, they don't care that they're wasting money. They'll sit there and say over and over again, we can't afford Medicaid expansion. We can't afford Medicaid expansion. But yet they can afford to, like, mess off all this money every year on these useless lawsuits. And not just lawsuits on this. Let's talk about all the times they've criminalized people for pregnancy outcomes that they've spent hundreds of thousands of dollars for no criminal case, just like nothing. So there's just all these weird priorities when we could be paying for Medicaid expansion, and then I could never get another call again for someone with pre-existing conditions that are unmanaged who now needs an abortion because they can't carry to term because of their pre-existing conditions that are unmanaged. You understand what I'm saying? Someone who wants to be pregnant.
Yeah.
Like, they don't care about those stories. You think I haven't went to the Capitol and told them stories? They don't care. They're just like, well, they should have been. Their idea is that as Black women, we're just letting ourselves go. You know, when we talk about the Jackson Clinic, they just see Black women, poor, irresponsible, slutty Black women. They don't see white women. So it's not their problem. But guess who does see the white women of Mississippi? Oh, we do in Alabama. Guess what I know now that I'm over here in Alabama more, right? Which I already knew that because I run an abortion fund. I don't only get calls from Black women, right?
Yeah.
Because white women don't want to be seen at Jackson. Shannon knows what I know. You understand what I'm saying? Like, they don't want to be seen by the antis because a lot of them know the antis. So we know that around 5,000 people get abortions in Mississippi every year. Only 2,500 go to like, abortions are usually done at Jehu. So where's everybody else going? And not everybody that goes to Jackson is from Jackson or from Mississippi. There's Louisiana folks that go there. There's people from Alabama that go there. So we know folks go to Louisiana, they go to Memphis, they go to Baton Rouge, and they go to Tuscaloosa. And we know a lot of them are the white folks in Mississippi that get abortions. Mississippi has a high population of Black folks, but we ain't all Black folks.
Right.
So, and I just want to get this out the way before it gets said in the post, like, because it always gets said every time we have a panel about Mississippi. Oh, why are there so many Black women who go to the clinic in Mississippi? And I always have to explain this because people can't math good. There are structural inequalities in providing care. Yes, baby, I know, you know. This is my granddaughter. Like, there are structural inequalities in providing preventative care, just like Dr. Torres already said. So Black women are more likely to have unplanned pregnancies and be unhealthy when we get pregnant and have things that we already can't deal with. We're more likely to be low income. That's from structural racism. So, like, all these things already are happening. Mississippi is 38% Black. We have the highest per capita Black population in the country. Jackson is 82% Black. So the clinic sits in a majority Black area and off of another majority Black area, which is the Mississippi Delta. So let me think, where are Black folks gonna go to get an abortion? I don't know. Are they all gonna drive to NOLA? Are we all gonna get in the car and go to Memphis? No, we're gonna go to Jackson Women's Health Organization because since the 90s, that's been a spot that's been there. So, I mean, like, there's no controversy. Black folks live where their clinic is. And we already broke. And we can't get birth control from the health department because they don't make it accessible. Period. Sorry, that was a rant.
No, that's okay. It's a rant that is completely on topic and absolutely to all of the points. And I am just looking at the flood of audience questions because there, as I suspected, folks have a lot to say and want to keep this conversation going. So I am going to start some of the Q&A and open this up because the questions have hit on all of the points that this initial conversation really started to open up. And so first, a lot of questions on what folks out of state can do to help that is the most supportive. This comes up frequently. Is it, everything from staff appreciation notes to donating to funds? And sincerely, there are people, we want to help. What works, what doesn't? So I will open that one up.
I'll go first. Send money. Send money to the clinic. Send money to abortion funds. Honestly, send money to people on the ground if you got money. Yes, send letters of support. Please, please, please. But if organizations have material needs lists, if they have a donation link, like the escorts have a donation link, like, donate to the folks on the ground doing the work. West Alabama Women's Center has a donation link. Also, donate to Mississippi Today because they are a nonprofit news organization doing the good work. Like, donate to the folks, Rewire, donate to the folks who are doing the work to make sure that you get this reporting, but also who are doing the work on the ground. And I don't mean that you have to be, I feel like people think you have to be a big donor, but you can be a monthly donor. If they do monthly donors, $5 a month is important. Like, that money means a lot to us in the long run. That's sustainable money for us. And I can't speak for Shannon, but I know West Alabama Women's Center needs money, right? Like, we have, most indie clinics have needs, whether it's security needs, whether it's roof, whether it's dealing with crap antis do, whether it's, I mean, whatever. And it's been a rough year because of COVID. So
yeah. Well, that's actually a really excellent question for Shannon that has come up too. Have you received any positive support from the local business community, or, you know, how are folks in Jackson to you and to your clinic?
We don't receive a lot of support. I'm just being honest
terrible.
with you. Everybody here are kind of hands off when it comes to the abortion issue and the abortion clinic. And that's the one thing that is our biggest barrier is getting people to step up and speak up about when it comes to this clinic. You know, people will talk behind closed doors and in private about it, but when it comes to stepping up, like, this is the time to step up, and people don't do that. I have people in my personal life who are pro-choice, as they say, but, you know, I can't get them to come to a rally. I can't get them to escort. I can't get them to donate. I can't, you know, it's been so many years that this has been going on, and I'm sick of people telling me that they have our backs when actually they don't have our backs. They're pro-choice maybe because a friend of theirs had an abortion before, or they, you know, something like that, but you're not. It's like they almost don't even really know what that means to be pro-choice. Yeah. It's just something you're saying, and that's what bothers me the most. I would tell people, more than anything, what we need people to start telling your friends and your family, if they believe in this, to speak up, to not just talk to you about it. Speak up, stand up, you know, donate, like Laurie's saying. You have to, at some point, you can't just say, I'm pro-choice. You have to, it's about action, and a lot of people aren't taking action to make a difference.
Is there anything else that folks from out of state can do to help support the clinic right now?
Just the same thing Laurie was saying, just donate. We are having we had some issues at the beginning of the year with like NAF cutting funding for our clinics and stuff. We do have the Pink House Fund. They changed some of their goals because people were donating and they wanted to go specifically for people having abortions in Mississippi. So the Pink House Fund changed their goals, and now we have a fund that that's funneled through, and that's helping patients now because NAF had to cut their funding, and ARC sometimes runs out of funding. So that has helped us a lot. So donating to the Pink House Fund or the clinic, that helps the patients here. That's just automatic. We have been like just like they're saying, this last year was hard for everybody. We worked longer hours. Our doctors worked longer hours. It was crazy because during the pandemic, where everybody's having it rough, where the fact that all of our doctors are flying in from out of state, where they were paying maybe $300 or $400 for a flight, the flights were being price gouged, the rental cars were being price gouged, everything had gone up. Oh my God, the PPP, everything, we were paying 2 and 3 times what we normally pay. So this was a hard year for everybody across the board.
Wow. And I think folks just don't totally appreciate that folks fly in to provide care, for example, you know, that is something that still doesn't necessarily isn't a default understanding for folks across the country. So we had a question in from Kobe Vance with Mississippi Public Broadcasting. It's Mississippi, as well as other southern states, have often been a battleground for abortion issues. A handful of abortion laws are created or proposed each year in state legislatures that ultimately leads to another lawsuit, something, Erica, you were talking about. What would need to happen to ensure that lawmakers cannot infringe on the reproductive rights of childbearing people? I love this question. Who wants to take it? Laurie?
We would need, I mean, I've talked about this in other media we need a federal law. We
Okay.
need federal intervention. We need something beyond Roe, something like the Each Women Act, something that says we need equal access across states. That
Mhm.
like what your access, your ability to access care cannot be determined by your zip code. And like, that's what we need. Honestly, we need the end of the filibuster. Get on that. Joe Manchin will never hear me, I know. But like Kristen Sinema and Joe Manchin need to get up off it. And like, honestly, we need that to pass. It just has to be a thing. And I think one of the things that has to, when progressive legislation passes, it's harder to take away something than it is to give access to something, right? Once you've given people access to a right, then it's hard to take that right away. And I think a lot of people don't understand what they're even missing, right? When you haven't had access to something for so long, it's like what I said recently to some high schoolers that interviewed me. I said, I've never regretted the fact that I chose to be a mom at 16 of my twins, right? But what I do regret is that I did not have access to all of my options. I didn't even think of abortion as an option. And so like, because I didn't even have that option, I sometimes went, would I have, could I have? Like, it's like, I don't think I would have, but I didn't get to have the option to think that out, right? I only have one child where I had all my options open to me and accessible to me. And I know for sure that I know that choice was fully mine. And like, I think people don't understand what it means to fully have options and fully know that choice to parent was your own versus this is a circumstance that I just have to live with and deal with and like push through the trauma to live with. And that's what I see for a lot of folks. I want people to be able to joyfully parent, even if it's unplanned. And I'm not seeing that in my community. And that hurts me.
Let me just, the Women's Health Protection Act, I think that's what they need. That's what we need. That's what we're trying to get passed. We've been trying to get that passed since 2013.
Years.
That's what's needed. I think that would help us. That would stop everything. And that's what we got. That's what we got to fight to get passed.
So a federal answer, it is what is needed. Erica, is there anything in terms of folks in the state that in lawmakers in Mississippi should folks really be looking for federal help here?
We would have to take back the House.
Yeah, I would think it would have to be federal at this point, the way the state legislature operates. But I think to piggyback off what everyone was saying, something that can be done across the board is definitely journalists and readers need to like be actively fighting misinformation. And that doesn't just mean the propaganda that, is used with a lot of anti-abortion legislation, but even, headlines and our news leads, like they need to be more accurate. A lot of the headlines right now are, Mississippi is banning abortions after 15 weeks. Well, that law was passed years ago, and now it's just finally at the Supreme Court. You can still access abortion after 15 weeks here up until Jehu will provide them. So I think journalists and readers need to be very particular with the language we're using. And remember, the clinic is still open. Every time I call Shannon to ask what's going on, she says she's fighting more misinformation. If it was after the heartbeat 6-week ban, women thought they couldn't get an abortion after 6 weeks, most of whom found out they were pregnant after 6 weeks. And a lot of that is because they Googled Mississippi abortion and it came up, Mississippi has banned abortion after 6 weeks, which is untrue. That's the intent of the law, but it's our job to be very specific about what's actually happening on the ground. Women need information, not just headlines. And that's for national media, that's for local media, that's for everybody. I challenge journalists to just be better with the words that are at the top of the story.
Absolutely, that's so true. And it's something that at Rewire News Group, we're constantly checking ourselves on as well, because as difficult as it can be to inform people in a way that doesn't feel disempowering, also, we don't want to engage in sensationalizing. These stories can stand on their own. They don't need hype from the media around it, because as Dr. Torres pointed out, there was a crisis of care before the Supreme Court decided it had something to say about it. And Dr. Torres, I asked you this a little bit, but we have a couple audience questions around this. So I thought I would open it up a bit broader and just, what are some of the plans that folks or conversations that folks are happening in, in preparation for a decision from the court here? I know that in Alabama, one of the things that, you folks are really doing is working to expand full spectrum care, not just because there's the uncertainty around abortion care, but because, as we've been discussing for the last 45 minutes, abortion care is an integral part of reproductive care generally. So is that shifting, is the Supreme Court shifting that conversation at all? And are there strategic or tactical things that you're thinking about to make sure folks can still get care in the event that the court goes sideways?
Well, I think that you can't be in reproductive health care without thinking about all of those things constantly.
Mm-hmm.
I mean, when I, moved here with the intention of broadening the clinic, just a little kind of snippet of my career path. I trained in fellowship to become an abortion provider, complex contraception, healthcare generalist, OBGYN, who could also provide abortion care. It wasn't until I moved to Alabama that I could actually do that, because of political, administrative priorities said, you can be an OBGYN, just not that part. So I have been working my entire career to have an actual comprehensive practice. And now that I'm here, I've just been doing it in the wrong direction. So I'm just starting, providing abortion care and expanding into the other stuff that I've been doing for the past decade. And that's fine, but that's where we're at. We start with abortion and expand everywhere else, as opposed to, I have everything going, let me just add abortion care. That's how it should logistically go. So it's always been a thing for me specifically, but as I'm here in Alabama now, I'm seeing how logistically difficult it is for someone to get birth control, for example. People apparently, this is new to me, like I'm learning so much. Apparently patients have to apply for a visit to a doctor's office, like to establish care. They can't just call and make an appointment. They have to fill out an application. And then that doctor,
it's bonkers,
or doctor's office determines if that patient can be seen, how quickly they can be. Like, this blows my mind, because it's not a job application. Like, somebody needs healthcare, you find a spot for them, but that's not how it works here. So down to the bare logistics of getting an appointment, I'm seeing a need. And so I'm trying to get people telehealth medicine. I'm trying to get them, remove as many barriers as I can. And the state laws actually make it very difficult to remove barriers that have already been put up for people to access healthcare. That's the conversations that I'm having now. I'm calling doctors who have referred patients to me because they don't know how to provide the medical care that I provide. And so I'm trying to make these connections and educate other doctors in the state about, this is actually how this medicine is done. Here's a little educational snippet for you. By the way, I'm a resource for you. Call me with any birth control questions, any abortion, any pregnancy questions, I can help. I am a resource for you. So that's where we're at. We're at the medical level is difficult for me to navigate as a physician provider, let alone a patient trying to get access to care. And Laurie has a lot more experience in this realm too. And I know that she's got a few things to add. So I'm going to hand it over to her.
I keep trying to shut up. I'm so sorry. No, I was going to say that's not uncommon. So we're patient facing and we actually give people money. So clinics don't always know when we're sending people, they have the cash in their cash app and they spend it how they see fit. But we get referred people all the time who are having miscarriages, and for miscarriage management, they have to go to the clinics. And so that even happened when I was an escort. People would be there because they had an incomplete miscarriage. And so their doctor was like, well, if I give you a DNC, it'll cost you $2,000 on your insurance, and you could just go to the clinic for $600. Or their office just doesn't even provide DNCs, so they just send them to the clinic. Like, there's an actual shortage of OBGYNs who do not know how to do DNCs.
Yeah.
And I was so shocked by that, because I remember my mom and her generation talking about DNCs like kind of casually, like it wasn't I mean, that was the kind of standard miscarriage management in the 80s. So it wasn't like I didn't know what they were talking about. But I just remember it being a common phrase I heard. So it's just so bizarre to me that like abortion stigma has gotten so bad that it's influencing just care that's not even abortion.
Yeah.
Right. It's just anything abortion adjacent, right? You've got home birth midwives who do not carry misoprostol, right? Because misoprostol is an abortion drug. But misoprostol is also one of the best drugs for, making sure you stop a post-birth hemorrhage.
Mm-hmm.
It's literally a WHO essential drug. So it's interesting to me how these like pro-life things play out in the most anti-woman, anti-person, anti-health. Like, these are not public health things. Like, I literally wrote on Twitter the other day, if I was Thomas Dobbs, I would be ashamed to have my name on this lawsuit. I would be ashamed to have my name on a lawsuit that's not going to increase any public health measures in this state, that literally would be known to impact public health negatively, that we know for a fact will have no positive health outcomes. And you're the state public health officer.
Yeah. Yeah.
I would quit my job. Like, no, hell no.
So as I expected, we blew through the time, and I want to hand it over to Shannon because we will be a year out from now and likely still not have a decision from the Supreme Court. So this is really, truly a marathon, and it's not even a marathon that is starting now, as y'all have done an excellent job explaining to everybody. This is a marathon that we, especially you folks, have been running for years. So first of all, we've got a year. What do you want folks to know about how to, support you in that time, if we haven't already covered it? But then also just getting through this year, what should we know from Jackson Women Health's perspective?
That's a big question. I just know that we're going to keep fighting. We're trying to fight as hard as we possibly can. Of course, we're not going to give up. We got the center fighting with us. So we got some good people on our side.
Mm-hmm.
And if the Supreme Court is who they say they are, and they are people actually of their word, then we should win. I would hope so. But, we don't know how it's going to go. But within this next year, we're just going to work hard to keep seeing patients, to hopefully not have to at any time stop seeing patients, because that's where the difficulties are going to come. What our next step is. If all else fails, worst case scenario, and we have to stop seeing patients, I still don't think that we would stop seeing patients, meaning we will find a way to get patients the safe abortions that they need, the safe health care that they need, regardless. We are hoping we don't have to do that and go to those efforts, but if that is what it comes to, then that's what it comes to.
Amen.
We second that.
I just want to say that this discussion, I was so looking forward to this panel, but it really even blew my own expectations away. And I am very sincerely sad that we only had an hour, because there are a slew of audience questions that we didn't even get to that I would really like to make sure that we answer. So we will be following up and answering those. And I just really want to thank all of you for taking time out of your day to join us, to talk to everybody about this case and providing care care. I mean, it's in the middle of your work days, especially. So I appreciate that. And to everybody who was able to join the event, thank you. If we didn't get to your questions, like I said, please email them to events@rewirenewsgroup.com and we will make sure and answer them. There were a couple questions about the outcome, about possible outcomes of this case, for example. I am happy to take those on. I wanted to make sure that we are centering the patients and providers in this conversation first, though. If you want to learn more about today's guests and their work, we'll be sending a follow-up email also with important links and information so that you can keep this conversation going on in your communities. I think that is really important, as all of our panelists really noted today. The thing that those of us who are participating and on this call and on this panel can do is really have these conversations in our own community, be agents of change where we live, and explain to the people in our lives how important not just this case is, but abortion care in general is. So absolutely, please do that. And if you haven't already, please subscribe to our YouTube channel and follow us on all the social platforms, Facebook, Instagram, and Twitter, to stay up to date on this historic case. And as a reminder, we are a reader-supported nonprofit news publication. So if you care about the work that we do, please head over to rewirenewsgroup.com/donate to donate any amount that will help us continue to host more conversation and events like this. We really want to be focused on what is happening in Mississippi, and with this case for the year, it's just too important not to. And so again, if you can, go over to rewirenewsgroup.com/donate. We so appreciate it. And just one final thank you to everybody for your time, for your insights, for your advocacy and work. It is beyond appreciated. Please keep an eye out also for news of our next event. We have a lot of stuff happening over at Rewire News Group that we're really excited about, and we're going to be sharing all of that in the coming weeks. And as always, abortion remains legal. So it's an important note to end on. Thank you all for your time, and follow-up questions will be answered. And as always, we will see you on the tubes, folks. Bye.